All right, so ready, set, go.
Good afternoon. My name is Tracy Yensko, and I'm here today with Kat Becker, Brittany Finstad, Savannah Peduano, and Labrissa Williams. And we're here to speak to you today about blood lead levels in children between the ages of 1 and 5. Lead is a naturally occurring metal found in small amounts in the Earth's crust that is toxic to humans. Due to human activities involving fossil fuels and manufacturing, lead now contaminates soil, air, water, and building materials. As a way of reducing the risk of toxicity, the United States began imposing restrictions on leaded gasoline and lead-based paints in the 1970s, which significantly reduced exposure. However, it remains a public health issue to this day, with the main cause being exposure from residual lead-based paint in homes that becomes disrupted. There are 500,000 US children between the ages of 1 and 5 with dangerously high lead blood levels. Because children in this age group are more likely to put their hands and other potentially contaminated objects in their mouths, they're more likely to ingest lead. At this age, their brains and nervous systems are still developing, which make them more vulnerable to the toxic effects of lead as well. Symptoms range from headaches, irritability, vomiting, lower cognitive functioning, organ damage, and even death. Most of these symptoms can be alleviated if found early enough. However, if damage is done to the brain, it is not reversible. The blood lead reference value is used to indicate children in the population with the highest blood lead levels and is currently set at 3.31 micrograms per deciliter. Children having levels equal to or greater than this value are at severe risk. This value is still high considering that there is no safe blood lead level. So the Department of Health and Human Services, or HHS, has set a Healthy People 2030 initiative target goal of 1.8 micrograms per deciliter. To attain this goal, the HHS must obtain accurate data of blood lead levels in US children. This data comes from the National Health and Nutrition Examination Survey and is collected randomly through in-home personal interviews, physical examinations, and laboratory tests to members of the US population. Although this is the most comprehensive data collection available, it does not truly represent the population and cannot be compared across states or counties. Data can be skewed based on population size, the number of children tested, which children are tested, and the type of screening recommendations used. Testing methods can also be skewed. A finger prick or a heel stick test can yield false positive results if any residual lead is on the skin, so a venous blood test is preferred. However, this test is not without fault as it is only accurate within 1 or 2 points, meaning a value can read 1 or 2 points higher or lower than the actual value. The city of Milwaukee, Wisconsin is of particular concern as the blood lead levels are double that of the national average. In a study of all 50 states by the Journal of American Pediatrics, the average percentage of children under 6 with detectable levels of lead in their blood was 1.9%. However, in Milwaukee, this value was 4.3%. Blood lead levels of 5 micrograms per deciliter were observed in 11.6% of the children, and levels of 10 micrograms per deciliter were seen in 3.3% of the children.
Right. So as Tracy talked about, we're going to be looking at the city of Milwaukee in Wisconsin, and that's where our local community progress and all of this data is coming from. So to start, for some context, on the right here in the orange box, we look at measurements. So Milwaukee data categorizes children into the positive blood lead level category, obviously if they're positive, or elevated blood lead level category if their blood lead level is 15 to 20 plus micrograms per deciliter. And there's a little variation in that because it's dependent on the test method, like Tracy said, and there's some skewing based on how testing is done. But if we look at the trends, so the number of children under the age of 6 with positive blood lead levels, so again, that's more than 5 micrograms per deciliter, we see that those numbers annually have been hanging out around 2,000 each year. And in 2020, the estimate for that data was around 2,500 children. Of that 2,500, more than 100 of them were elevated blood lead levels. So those are children really with who are going to need some support for sure. So that is our data in the past. If we go to the next slide, we'll see where that is currently heading. In 2022, obviously it's the beginning of the year, but our data is on track for over 2,000 positive blood lead levels again in the city of Milwaukee. That also tracks with the over 100 elevated blood lead levels in the city. So again, those are our children with 15 to 20 micrograms per deciliter on their blood lead level tests. So if we look at that, There really hasn't been any significant improvement in blood lead levels among children in the city. This map on the right here shows the city of Milwaukee. It might even show the whole county, but the majority of our positive tests are concentrated near the center of the city in some of our lower income neighborhoods. So this really tells us that childhood lead poisoning remains a significant challenge to public health, and that's something that Milwaukee is definitely dealing with. So we might be thinking, what are some factors impacting progress, right? So Milwaukee has a whole childhood lead poisoning prevention program dedicated to these kind of outcomes, but we're not seeing much progress at all. So some things that have been impacting this program's success, and these are points from an audit that was done in 2020 and then again in 2022 on the program. There's been poor adherence to state statutes on the Wisconsin level and guidelines for follow-up and case management. Some kids are testing positive and their families are not finding out for weeks and weeks. There's been some lack of proper documentation, lots of turnover in the field of public health. And then again, that's something that's just reinforced by the pandemic. So folks are leaving these jobs, their documentation isn't stored properly. There's still a transition between these hard records and these electronic health records. So it's really just a program that is not doing too hot, and it's been exacerbated by the pandemic.
Some policies and programs that we have for our designated population of the children in Milwaukee that can help reduce blood lead levels. One of them is run by the city's health department, and every year they have created an audit producing the findings and observations of the projects and programs interventions. This project is called the Milwaukee Health Department Childhood Lead Poisoning Prevention Program. The Childhood Lead Prevention Program, or CLIP, is a program that was devised by the Health Department of Milwaukee to help track and intervene on the amount of lead poisoning that is in children. They intend to provide policies and procedures to help lower the lead levels of children in their city. The CLIP program works closely with the Housing and Urban Development Program, as well as the state's Department of Health, to help monitor and insert interventions in the development of the highest levels of lead poisoning in children. They also provide lead level screenings to those in those communities as well. The 1986 Safe Water Drinking Act is one of the main acts that has gone over in reducing the blood lead levels in children. It's brought about the Reduction in Lead in Drinking Water Act. This act prohibits the usage of any lead materials in the creation of piping for any sort of plumbing products used for human water consumption. The policies that yielded the best results for reducing the blood lead levels of children are the Reduction in Lead in Drinking Water Act, as well as the banning of lead in gasoline. These are the most effective federal policies that help reduce the blood lead levels in children. There are some other key federal programs and policies that help reduce lead levels. The Lead-Based Paint Poisoning Prevention Act of 1971, the Lead Contamination Control Act of 1988. Lead plumbing was eventually banned in 1986. There was total elimination of lead in gasoline in 1988, and the amount of lead in children's products was reduced to about 0.01% in 2011.
So to reduce childhood lead poisoning, we are recommending embedding community health workers within communities. Community health workers build capacity within communities by providing health information and promoting self-sufficiency through outreach, advocacy, and education. A community health worker is a trusted member of and/or has unusually close understanding of the community that they're serving. The community health workers will provide primary prevention and assess home environments for lead hazards to prevent children from being exposed. Primary prevention is the most effective way to ensure that children do not experience harmful long-term effects of lead exposure. The community health workers will assess homes of pregnant women and children under the age of 6 and they will also offer resources to remove the hazardous materials that may be found. Every family will also receive educational information as well as information on secondary prevention efforts, including blood testing and follow-up care. We're also recommending implementing a multi-pronged approach to increase access to blood testing for children. And that's on the next slide, please. And knowing that testing has to be accessible and easy to navigate. And so to ensure the ease of these testing options, we're recommending on-site and walk-in testing options at local hospitals and clinics. We are recommending that we develop partnerships with federally qualified health centers, or also known as FQHCs, to really increase awareness and testing opportunities for families within these communities. And then we know that care coordination is super important to ensure follow-up and the referral process for people to get tested, to receive care if they do have elevated blood levels. So wanting to make sure that there's care coordination between clinicians and between providers. And then lastly, we want to mandate training for new clinicians on best practices for secondary lead prevention. And so making sure that everybody is up to date with the new guidelines to really see prevention and to reduce those blood level numbers. And then to ensure that we are making progress in reducing the number of incidents of blood poisoning in children, we're also advocating for policy change and for there to be mandated testing for all children ages 1 to 2 years of age.
So in order for the team to completely achieve these goals, we would need a budget of approximately $350,000 per year. This would allow adequate funds for the team of community health workers, educational materials, testing equipment, blood testing equipment, and a policy change task force in order to get that policy change to occur. The funding levels, we expect them to remain consistent over time. They'd adjust slightly every year for the influx or outflux of population demands and adjust for inflation as time goes on. Ultimately, though, we do expect that the funding would be reduced slightly as that policy change is achieved. Here you can see a breakdown of the $350,000 of funding. First and foremost, we have it divided into multiple expenses, the most expensive being the community health workers. These are the outreach personnel, the one that would be visiting the houses, and we have allocated $150,000 for that. And that is based on research of the salaries for community health workers in Milwaukee. Next, we have the equipment. This includes equipment like the water lead measure and the lead check swabs. With market research, we found that those were $18 and $200 per pack respectively. And so we have allocated $10,000 and $50,000 for that so that we get the correct amount in order to test all of the houses in Milwaukee that need to be tested. As for educational materials, we allocated only $10,000 for this because it's going to be pamphlets, flyers, and possibly some community outreach, but it's not going to be the largest expense. And then blood testing materials, lab tests, tubes, needles, and all of those supplies we have given $55,000 for. For the policy change advocates, it's going to be a small group that works closely with policymakers in Milwaukee, and we have devoted $75,000 for that, and that is also based on market research of the salaries required. So as stated before, all of these figures were reached through research on the prices of certain supplies as well as salaries, but the community can really expect a great return on investment with positive outcomes from this program, because not only is public health going to be better in the community, there's going to be less children with lead exposure and lead poisoning, but it's also going to create a really great relationship between the community and the health industry in Milwaukee, and that will help foster an environment of trust.
And these are some of the references that we have used running through our programs and interventions that we would like to run through for our change. There are a few more after this, and I wanted to thank you so much for going through our presentation, and have a good night.